Hello. There seems to be quite a bit of confusion around whether to use hot or to use cold if you're suffering from an injury. So I thought if I explain a little bit about what happens when you get injured, it might be easier for you to know whether you would need to use hot or cold or even a combination of the two. So when the body gets injured, there are two responses that take place. The first of these is muscle spasm, and the second of these is inflammation. The muscle spasm is there to try and protect the joint, and the inflammation is there to try and provide the nutrition and the healing particles that your body needs to stitch itself together or to glue itself together, whichever you relate to in that scenario. Now, both of these conditions, muscle spasm and inflammation, can actually and do actually cause pain. So this is where hot and cold come into the picture. But both hot and cold have two side effects each. So there are potentially 4 side effects from using hot and cold. So again, if we explain what these are, you can look out for these and manage yourself better at home. First of all, with heat. Heat does relax the area and it does reduce the muscle spasm, which will give you some relief. But the downside of this is that if you release too much muscle spasm, you lose the protection that the body has given you. And the second problem is that heat itself actually increases inflammation. On the other hand, cold actually helps to bring the inflammation down, which can give people a lot of relief. But again, this has 2 side effects. Number one, if you overly chill an area, you actually make it stiffer, and that itself can lend itself to pain. But more significantly, when an area is chilled down and you reduce the inflammation, by definition, you are reducing the number of chemicals and particles that are being drawn into the area for healing. So by overly chilling an area, you can, in certain cases, actually prolong your healing cycle. So it's important to try and get an idea, if you are injured, whether or not you are suffering more from spasm or more from inflammation. And for example, in my own particular case, I tend to get more inflammation in my tissues when I'm injured. I can reasonably move about, a little bit stiff, but much more by way of inflamed, whereas some of my patients can be the opposite. They'll come in a position like this completely stuck. And for those people, they would probably need more heat to try and reduce the spasm. So what you might need in your own situation will vary, and I would suggest that you go with your intuition to begin with, but be guided by the science of what we have just discussed. Also, it's important to know how long to apply the hot and cold for. Generally speaking, we say heat or cold maximum for 10 minutes. And incidentally, the cold does not really need to be frozen cold. It is much better to have it fridge temperature and to use a proper ice pack that maintains the cold for that length of time. So after the 10 minutes have passed, leave about 1 to 2 hours before you reapply your hot or your cold agent. If you are confused as to what to use, hot or to use cold or to use a combination, why not give our clinic a ring? We have some lovely friendly osteopaths here who can help you to work out what you need, and you don't necessarily have to come in. We have helped many people over the telephone. We are also available by email if you would prefer to write in. I hope you have found this information helpful, and if so, please do share it with other people. That would be good for us as well as good for people who receive this information. Thank you very much for watching.